So I want to welcome our two other panelists to the screen. Janice Cowden, and Janice is joining us from Florida. She was diagnosed with early stage triple negative breast cancer several years ago, and then had a metastatic recurrence in 2016, and she has been NED for 3 years. And I also would like to welcome Nunny Reese, who is joining us from North Carolina. And Nunny has hormone receptor positive, HER2 positive metastatic disease. And I want to welcome you both to the program.
Thank you.
Thank you, Janine.
Thanks for being with us. So I just want to quickly ask a couple of questions of the two of you, and then we'll start to take a look at the Q&A. Also going to run a poll while we're talking about the issues and things that you may be having difficulty accessing right now. So look for that poll. So Janice, let's start with you. If you could briefly share your story. I know that you recently had a suspicious looking respiratory illness and had some difficulty accessing at the beginning of the crisis. Could you briefly tell us what happened and how you dealt with the stress and anxiety around that situation?
Certainly. Thank you to LBBC and thank you, Janine. I'm happy to be here today. Yes, I started getting symptoms that were COVID-like in early March, and went to see my primary care provider and requested testing, and they said they didn't have it available. I worsened, went back to my primary care within about 5 days, and once again requested testing, and they said they didn't have it. And they sent me to the emergency room where they said I would be tested. I went to the emergency room and they said I did not meet the CDC criteria for testing. So in a span of 2 weeks, I was on 3 different antibiotics and several different treatments. And during that time, I was actually supposed to have my 6-month PET scan, which I fly from Florida to Houston, Texas. I have an oncologist at MD Anderson and one here locally as well. Due to my illness, that got rescheduled. And then eventually that was rescheduled a second time and then finally canceled because of the COVID restrictions and the fact that my oncologist did not want me to travel. And they were also waiting to see if I would be tested. In week 3, I finally went through a drive-through test and was tested and told I would get results within a week. And then my primary care asked me to come in to their office. They had test kits. She tested me a second time. During this span of time, I had 3 influenza tests that were all negative. And my primary care was certain that I had COVID. Both of my tests took 13 days to come back, and they were both negative. My primary care felt that the reason they were negative is because I was so far out from the beginning of my symptoms, and she felt that they were false negative tests. And through it all, I'm now, I did finally get my local oncologist to schedule my 6-month PET scans, which I had last Friday, and I'm still no evidence of disease. So,
can you tell us a little bit, I mean, something that that Jean sort of alluded to at the beginning is that I'm certainly seeing in the metastatic community is that you already have a lot of resiliency skills that you employ every day because you have a life-threatening disease. Can you tell us a little bit, Janice, about, because that must have been an incredibly stressful experience thinking that you might have COVID-19 and in fact you may have had it. What are some of the ways that you managed that stress, waiting for the results of the test, not knowing whether you would need to be hospitalized? How did you manage that?
basically, I just tried to not get too worked up over the whole thing. At first, it was very difficult. My husband was actually out of state. His mother had had a stroke, so I was home alone. And during the worst part of my illness, I was here by myself. So I knew that I basically didn't have a choice, but I kept in contact with my primary care physician, as well as my MD Anderson physician through the patient portals, and gave constant updates. I tried to keep up on the latest news, which was constantly changing with COVID as far as, you know, getting testing. And within the community, I found that I was reaching out. I use social media a lot anyway, but I found out that I was using it even more and going a little bit further and actually one-on-one contact with a lot of my metastatic friends, and many of them reached out to me, which was wonderful. So that basically sort of kept my fears at bay as much as possible.
Thank you. Thanks for sharing that, Janice. And I want to introduce Nani now, because you've been waiting there as well. Now, Nani, your situation is like many people's in that you're going regularly for your treatments, and actually right now you are going through whole brain radiation. So you're going on a regular basis for your appointments. Talk to us a little bit about what it's like to be going in for those appointments during this time.
I actually, and thank you for having me. I appreciate it. For me, it's been really difficult. I just finished 10 rounds of the whole brain radiation. And, you know, on top of dealing with that, whenever I leave my house, I'm already thinking, you know, about it's additional stress, which adds on anxiety. You know, I'm thinking about whenever I get to the cancer center, how many people are going to be there. How am I gonna have space to myself so that way I'm not surrounded by a lot of people. Open up the doors, using the public restrooms. You're already kind of thinking of them things so that way you try to be as safe, keeping yourself as safe as possible, because you know other people, I guess I say regular people, they're just dealing with just the virus itself and thinking about the virus itself. I'm thinking about not just the virus itself, but getting through the side effects from the whole brain radiation. I'm thinking about me coming back home because I do have a young son here and a son that's just came back from college, not, you know, making sure they're not getting anything, making sure my husband's not been contacting, getting anything. So it's very difficult and it is stressful. You have to have like a lot of support. Me and my husband, whenever we do go to the cancer center, he's having to open up the doors for me, making sure that I'm not touching anything, because you just don't know. And it's just something that stays within your mindset. And you, like I said, you just already kind of having that fear of not picking up something because you know your sales is already low. You're already feeling, you know, I'm sick as it is. And you just have to make sure that you just kind of follow the guidelines and that you don't pick up anything. So emotionally, it's been really, really tough.
Yeah, it sounds that way. And Nani, you're talking a lot about the stress, and that's some of what came through in the questions in the beginning of the program. What are some of the things that you are able to do for yourself to manage the stress?
Some of the things that I'm able to do, for one, I keep myself in the know. You know, I try to stay updated with, you know, with what's going on with my local news. And I try to make sure I always have a mask on, wash my hands. Again, I say that I have a huge support system. So some of the things that I try to do for myself, like I said, just try to protect myself as much as I can and just continue to educate myself. So that way I know, you know, some of the things that I shouldn't be doing, some of the things that I can do. So that way, when I do have to leave my house or someone having to come over, which I don't really have company at all, that's one of the things that I do to for myself as well. I allow no one over here. If it's not my children, not my husband, anybody have to come, if they have to bring me something, they leave it on my doorstep. And because I just can't afford to take that risk. And people understand that, you know, they don't look at it like, oh, you know, she's being funny. They understand that there's just certain things that I cannot take a risk for, and they understand that mostly.
That's good to hear, Nani. So actually, Greg, I kind of want to transition and ask you a question that came in during the last part of the program and is related. Gina says, my concern is a lack of understanding by others in her own circle that there could be specific risks because she has metastatic breast cancer and may not have other options for living or isolating in the same way. How are you advising your patients who may not be getting the kind of understanding that Nani is talking about in terms of needing to protect their health and the health of those around them?
Yeah, it's a really important question, and you know, I think that now is the time to really, and there's no lack of advocacy in this organization or for many of the people here, but it's just not okay. If you're not living with people, the people and there are others coming in, they should not be there. Minimizing exposure as much as possible, it can be life-saving for yourself and for others. And there really is, that's the best thing that we know right now. And if people have hurt feelings, there's not a whole lot we can do about that. From a public health standpoint, the more that we avoid other people and maintain social distancing, the faster we will flatten this curve, the better that this will go for everybody. And just to kind of go back to an earlier question, the benefits of flattening the curve and the benefits of having some more predictability around what is going on is the ability to get back to scans and other things that have are part of treatment. And the more uncertain things are and the more people are violating these things, the more dangerous it becomes for everybody and the more protracted this will become needlessly. So I'm not being shy these days. I think you know, we're all at risk. Our population is at risk, and people who are immunocompromised are at even greater risk. And you know, I think when survival and health are the you know, threatened, we can start by asking nicely and trying to educate people. But I think after that, I just can't do this. I cannot be around other people during this time. If you'd like to talk, I can do it via Zoom or telephone call or whatever else.
And another thing that people have to realize, whenever we're going through treatment, sometimes the side effects that we have is a lot, they're similar. So sometimes if I have like a dry cough or a fever, which a lot of times I do, finishing, you know, whole brain radiation, that fear comes along as well, because it's like, okay, is this, if I'm having these symptoms because of the whole brain radiation, or am I having these symptoms because I picked something up? So that too is something scary and that you kind of have to watch for. And if I feel like it's something that may be different, I'll call my oncologist and I say, you know, hey, I'm having these symptoms. I can't really tell the difference between what's the whole brain radiation and if I actually picked up something as well.
That's a really important point, Nani. Greg, did you want to add anything about that?
Yeah, that's a great point. And it's something that we're contending with in our cancer center all the time, because people have symptoms. Most of people's symptoms are not COVID symptoms, even if they have a cough or a fever, and particularly in the cancer world where neutropenic fever is definitely something we see. One of the things that we have been meticulously careful about with people who are undergoing cancer therapy and have a fever or other symptoms is not to immediately write that off to COVID. Neutropenia, a neutropenic fever is very easily treated when we figure that out. And the worst thing that could possibly happen is somebody who has a neutropenic fever from treatment being assumed to be COVID positive and being put in an area with other potentially COVID positive people. And so it is, the oncologist is the person, and I'm not a physician, I want to say that a million times. The oncologist is the one who should be taking point on that. So we can understand and treat things expeditiously and not kind of go down paths where people are becoming unnecessarily frightened or you're getting into an environment that you do not want to be in. If you are in any environment medically where you're not around an oncologist, please tell people that you are on, if you are on chemotherapy that can suppress your immune system, because that is a very important piece of information right now.
Thanks for that advice, Greg. And I want to ask one of the participant questions of all three of you. Also just want to say I can see things popping up on the chat, and several people are saying how inspiring it is to hear from Janice and Nani, and to also know that they are not alone in their feelings about being isolated. So I'm really, really glad we have all of you here to be able to validate that there are a lot of people who feel the way you feel right now. I'm going to ask Alexis's question, and she is saying, sometimes it's hard to balance leaning on family support versus a feeling of burdening them. I don't want to scare the people around me, but I get very stressed and the tears come. What advice do you have for emotional wellness? And I would love it if each of you could address this, and I'll start with Janice.
That's a great question. And I think the answer is that there is no one answer to that question. I think it depends on the person, the relationship with the family, the age of your family members. There's so much that goes into that. My family is very open, and I have never hidden anything from any of them. My children are adults, and from the very beginning, from my early stage as well as my metastatic diagnosis, we're very open and honest about everything. So I've never had to worry about whether or not my fears and my anxieties would increase theirs. And for me, that's a gift. And I'm an open book with friends as well. So I think that there isn't an answer. I think you have to do what works for you. And, you have to always consider your audience, who it is you're speaking with, and who it is you're around. And, if you have young children, maybe they're very, very negatively impacted if you are expressing extreme anxiety or fears and so forth. But I don't think there's one answer for that question.
Thanks, Janice. I appreciate that. And Nani, how would you respond to that question? You have several children in your house and your husband and a whole brood there.
About like Janice, I'm an open book. My family, we're open book. I don't hide anything from them. When I was first diagnosed, I always told my boys that, because I have a 21-year-old and a 20-year-old, and then I have a 10-year-old. And I always told them up front that I would be honest with them, because if they're okay, I'm okay. And the same thing with my husband, which is one of the reasons why I share a lot of my story and my truth on social media. With my 10-year-old, at first I was kind of like, how would I explain this to him? But you'll be surprised how much kids already know and how well they take things. He'll come to me every day. If I have treatment, Mom, is the cancer cells going yet? Well, we're going to get him beat him, right? So he's so positive about things, which also put me in a positive light. Same thing with my husband. He's very supportive. I don't really have that issue. Same thing with my family. We just speak really positive about things, and I have always been that way from the start, from day one. Like Jenny said, you have to kind of whoever your audience is, you have to just make sure you just say the right thing. It's just the truth. It's just your truth, and it's just you being honest. That's the best way to do things.
Thanks for sharing that, Nani. And Greg, I want to throw that question to you. I also want to ask what advice you're giving to people who may not have any support in the household with them. So, obviously there are people in our community who are single or who aren't partnered and who are by themselves in an apartment. What kind of advice are you giving them in terms of getting some support at this time when they're sort of doubly isolated?
Certainly, I think it's a terrific question. And I both of your answers I love. And I think that there is, for people who are isolated, anything that is offered virtually right now is something that can be called into if you do not have the ability to join by screen. And I think all of those things can help to relieve isolation. There are a variety of online support groups. There are yoga classes, there are mindfulness classes, there are stretching classes, there are just networking things that people can participate in. Also, it's not illegal to go outside as long as you socially distance. Sometimes just being outside and being around other people and being socially distanced around other people, but just kind of seeing that the world is around us. And at least in the Northeast, we're in springtime right now and things are blooming and it smells good outside. And even if we have to be really careful, I think change of scenery can be really, really important in all of this. And with kids, one of the things with younger kids is that they're just frightened. I mean, their routines have been disrupted, and it's a fine if your child sees you cry. You don't want that happening 24 hours a day, but giving kids something that they can do to be helpful will help to relieve some of their feelings of helplessness. So it doesn't have to be big, but it's a really good way to provide a little bit of structure and help them feeling like they're making things better for you, and it will go a long way. This does not this isn't going to look pretty, but our job is to get through this as well as we possibly can. And I would encourage people not to be too hard on themselves about this. It's extraordinarily difficult, and we're all asked to do things that we have really never been asked to do before. And and we're asked to adjust to that in a matter of weeks, which is like monumental.
You know, when things started happening, I brought my son, it was a book. There's really good books out there that you can actually give to your child. As things started happening with me, like whenever I knew my hair was going to come out, I said and I explained that to him, and I let him be a part of it. I would ask him, you know, do you want to sit with mommy, you know, while I'm cutting my hair, and what do you think about it? Mommy still. So I let him kind of engage with things that I was doing, so that way he wouldn't be so fearful and be scared, because sometimes when kids see, you know, your head is shaved, they thinking, okay, well, something is different. Is mommy's going to be okay if she's dying? So I try to explain to him and like show pictures in magazines, you know, hey, this is what she went through. This is what mommy's going to go through. And this is what it's going to look like. And even with, you know, picking out a wig, I was like, you want to help mommy pick out a wig? So there's things you can do so that way your child, especially at a young age, won't be, you know, so scared and have a lot of fear.
And Janine, if I could add to Nunny's, that was one of the things I was going to mention too, is LBBC has so many wonderful resource materials on how to speak to your children, and, you know, all of that people can access. But also, I have heard from so many of my metastatic friends that those who are not transparent with loved ones, sometimes it backfires. And those loved ones start making assumptions, and sometimes those assumptions are the worst possible case, when maybe that's not necessarily true. So I think you really do have to know the person that, you know, that you're dealing with, whether it's a young child or your spouse or friends or whomever. But I think sometimes finding a level of transparency that doesn't increase anxiety and fear or doesn't make them assume the worst may always be a good approach too.
I think that's great advice, Janice, because it's true. Regardless of the age, we all rush to fill the void. So
Yes.
if we don't understand why something's happening, we will create an explanation in our heads that may or may not be a productive one. I'm going to ask my colleagues to bring up the poll so we can see how folks answered it. We asked, what have you had the most trouble accessing since the outbreak? And about half of you said you didn't have trouble accessing any of these, but 26% of you said emotional support was the piece that you were having the most trouble accessing. It's interesting, it's almost equivalent with medical treatment and care. So a number of different issues here. Greg, can you comment a little bit on people who may be having difficulty accessing emotional support, and what are some practical things that they can be doing to do that?
Kind of, as I mentioned earlier, but there are a lot of options out there for kind of online types of or phone type emotional support. And I'm happy to share resources with the entire group after this, but this is a fairly savvy group, starting with the cancer support community, cancer care, LBBC. There are many things out there. Also, most people who have insurance have some kind of behavioral health benefit that's part of that, and that group has also moved dramatically to televisits, and it's perfectly reasonable to chat with a social worker or psychologist or somebody else. You know, I think everybody is different in terms of what their needs are and what feels good emotionally to them, but I have seen a fair number of things being moved very quickly to being able to be done remotely, and I would avail yourselves. We have at where I work, we have a whole bunch of trainees, clinical psychology trainees, social work trainees, others who are just like waiting to help people and kind of reaching out to wherever you're getting treated, or to others in your area who may be seeking support. You may find a resource. You may find somebody who is available to talk. So, and I would talk with, I don't know, everybody gets treated in different practices. Some have social workers, some don't. But the one thing that I have noticed during this time, more so than at any time ever I can remember, is when I call people, they answer the phone. And it's been illuminating. So like, call people, reach out to them, do what has worked in the past to relieve your anxiety.
Thank you. And I think you may have said this, but I'm looking at questions while we're talking. But obviously it's possible, we talked about telemedicine in terms of talking with your physician, but there are also a lot of ways to get telemedicine for access a mental health provider as well.
Yep.
And I know actually your institution has a pretty rigorous telemedicine practice in all areas. So that's something that people also could use if their benefits allow access to that.
And reach out. I mean, I think there are a lot of medical questions that came up here, and these are questions that in any other time people would direct towards their oncologist, and you should keep doing that. Oncologists are kind of looking to be helpful all the time, and I think if a 10-minute conversation with an oncologist, whether it's by phone or telemedicine or Zoom or Doximity or whatever, if that can relieve your anxiety, by all means, please do that. I know where I'm working, like people are calling people back really quickly because we're kind of recognizing the, how powerful that can be. So use those resources, ask those questions. People are available to help, and everything except like labs and scans and chemotherapy, and I'm sure people come up with a bigger list, really can be done remotely, which we are learning now too. And so don't hesitate. It's not that they're so busy. Most oncologists now are sitting at home doing telemedicine or phone calls with their patients while others are in kind of doing treatment related stuff. So they rotate staff through. So they're just waiting to talk to people. And I think it is really worth reaching out because a lot of the questions that are coming up right now could probably be easily answered by your oncology treatment team or nurse practitioner or PA or whoever else is taking care of you.
Great. Thank you, Greg. And I want to get to a question that we've gotten from a couple of people. We have several folks with us today who are newly diagnosed. People are still getting diagnosed with metastatic breast cancer during this crisis. And one of our attendees says she's newly diagnosed and having a really hard time accepting the diagnosis. What tips do our panelists have on how to deal with the grief and anxiety in this time?
I'll start it if that's okay with Nani.
Mm-hmm.
I think one of the things that I've experienced, and I've also noticed it with other metastatic friends, that when you're newly diagnosed, I think the first thing you have to do is be patient with yourself. And we often go through the same stages of grief when we're diagnosed as we do when we experience a death of someone that we're close to. And you have to allow yourself to feel those feelings. I think you have to give yourself grace and time to get used to it. It doesn't happen overnight. And I think everyone gets there at a different time. Don't have expectations of yourself. Like you've been diagnosed, by this time, I should be there. I should be accepting, I should move on and be okay with it, because then that just puts an unnecessary amount of stress on yourself, having that expectation. For me, what I did to get past the initial shock and fear was I got connected. I got connected with social media groups. I got connected through Living Beyond Breast Cancer as a Hear My Voice advocate. And for me, what has worked the best is becoming a patient advocate. And by helping other people, it has helped me. So I think less about my own disease and how I'm dealing with it, because I'm helping others, or I hope I'm helping others.
Well, thanks for that, Janice. And I think it's really important right now because another person who is also newly diagnosed was commenting that the supports that are typically there when you're first diagnosed, like support groups, you can't physically go to them right now. So right. One of the best places to be able to connect with other people who've been through this is online or via a helpline like Living Beyond Breast Cancer's helpline.
Right.
Is there anything you would add to that?
I would like to say, about like Jenna said, you have to, when you're newly diagnosed, just give yourself time to adjust, to what's going on. One of the biggest things that I will also say is do not go on the internet and looking at different sites, because you would scare yourself. There's all kind of information out there that's not good. If you want to know about a website, ask a physician so that way it can be a trusted website. So just try to stay away from that and just give yourself time. And like Jenna said, figure out the things that's going to work best for you. If you have a family member or close friend, try to have someone that you can kind of lean on for support. Try to find that support, right away, because that's very, very important.
Thank you. And Greg, I'm sure that you're seeing some newly diagnosed metastatic patients at this time. Are people experiencing more severe anxiety than they even typically would, just coping with a regular diagnosis of metastatic breast cancer?
So this is all really new, and I would say certainly it's always hard to kind of tease out what's what. I think what has been reassuring for many is to know that treatment can be initiated and we can do most of what we were able to do before, and extraordinary precautions are taken to help newly diagnosed patients get into treatment and get treated in a timely fashion. But yeah, this is terrifying. I mean, I think that all of us are probably walking around and we've gotten kind of, to some extent or another, used to what we're living in right now, even if we're feeling distressed. And I think when you add something on top of that, it can very, very quickly become overwhelming and take some time to kind of let that settle down a little bit. But I think with anybody having a new diagnosis of either primary or metastatic breast cancer, often anxiety, and I have not had breast cancer, but often anxiety does reduce once treatment is initiated and a plan is made. And I would encourage again people to reach out to their treatment teams and to do what they can to kind of move along that trajectory, because it is safe to get treated. Nobody wants people in treatment to get COVID. Everybody wants people who can benefit from treatment to have it. And there is a tremendous energy and effort right now going towards that. And I have found that kind of personally reassuring, how quickly things have been mobilized to make the modifications that we need, but keep people moving and getting what they need to improve the quality of their lives and lengthen the duration of their lives.
Absolutely. And I'm also, I think Gina and I are also both hearing, we're talking to people on both the early stage side and the metastatic side, that healthcare professionals are just so focused on what are the ways we can balance delivering the best standard treatment while still protecting everyone from developing COVID-19. So as Jean said at the top of the program, we're so grateful to all of our healthcare professionals for everything that you are doing to continue to support the community, both in physical health and emotional health. So I have an interesting question from Jesse, who is asking, how do you balance the monitoring you often already do as a cancer patient? And now we have this kind of elevated self-monitoring because of COVID-19. So how do you do that without developing too many OCD-like behaviors or ruminations? So, sort of we have to wash our hands a lot. How do you, and you have to do it, but how do you do that without becoming sort of obsessive in your mind about trying to keep everything clean and trying to protect your health?
Yeah, no, for sure. This is a wonderful opportunity to exacerbate all of our OCD symptoms, because it is, there's truly now evidence that a bit of OCD is probably protective. And I think you just need to break up the anxiety with other things, because if you are solely focused on staying safe and being okay all day long and nothing else has changed in your environment, you're not going to relieve your anxiety much. So any kind of distraction, any kind of online exercise class, mindfulness exercises, anything to kind of get you out of your head a little bit, I think really makes a lot of sense. I think the other thing that we are seeing, and kind of one of the scariest things about all of this, is just not being able to find out. Rapid testing is going to become more widely available for people to get answers faster. And one of the things that has really driven anxiety is, and many of you have mentioned, and I've seen in the questions, is kind of this, I have a symptom, I have a fear I had a potentially high risk exposure. How do I find out if I have it or not? And up until, recently, could be a week and a half, if at all. There is a tremendous effort in the academic side and in the private industry side to get rapid testing to market and make it widely available, because that's going to be the key to relieving some of the restrictions that we're all under right now. And so do watch for that in the coming week, couple of weeks, 3 weeks, month. You'll be able to get an answer to that question. There are home testing kits that will become available. There are serologic tests, which will be able to tell you if you've been exposed and have developed antibodies or not. So those things have been very slow to come in the pipeline, but I think there's a critical mass right now, and we're going to be seeing that. We're already seeing that changing. We went from being able to do the 950 bed hospital. We went from being able to do like 25 rapid tests a day to thousands of rapid tests a day within a week and a half. So I think we're going to see that nationally, and I think that will be relieving when people are able to actually get the answer to a question.
Thank you. And I want to go back to another question. So one of our listeners is asking, what if you don't have any family? I'm an only child, never married, no kids. My parents have died. I have lots of friends, but I can't go see them at the moment. What are some tips, Janice and Nani, that you might have for helping people stay in touch?
I would say it depends on what your preferences are for communication with other people. If you are a user of social media, it is a great place to connect with others who are like-minded, others who are living with this disease, because as we often say, no matter how much family we have, how many friends we have, how great our support is from our family, unless they're living with metastatic breast cancer, they don't get it. And I think it's very important to be able to connect with people who do, so that you can share your feelings and ask questions and so forth. So if social media is not an option, there are so many organizations like Living Beyond Breast Cancer's helpline where you can call and connect, a peer matched person that you can speak with. And there are other organizations like SHARE that has a helpline that you can call. If you have a local American Cancer Society that has a support group, reach out to them. They're, a local Komen organization. There are so many organizations out there that have support available. And I think you just have to tailor it to whatever works best for you.
Yeah, I would definitely say pretty much what Janice was saying. And one of the things that you can probably benefit from as well, I know a lot of women that I spoke with stage 4 said that they tapped into seeing a counselor, so that way they had someone that wasn't family, they didn't really know them, but they was able to speak with them and talk to them about their truth. And because of the fact they didn't really have family members or close friends, and they just felt better with seeing someone, so that way they can let some of the emotion and can pretty much let it out. So that would be a good way as well, counseling.
Thanks for sharing that. And I just want to add that I know that there's a lot of kind of virtual happy hours, virtual dance parties, and all kinds of whatever it happens to be that you're into. There's virtual spiritual gatherings, and it may take a little time to get online and find them, but they are out there if you're looking to connect with people outside of the cancer community, because so many people are feeling so isolated now. And also know a lot of people who are using Zoom just with their friends or family members, or even using Facebook instant messaging, which allows you to see people on video. So those are some other tips that might be helpful. I just want to ask my colleagues to bring up the one poll that I don't think we shared the answer to, because we're getting close to the end of our program and I want to be able to share out. We had asked what people's biggest concern was today. And not surprisingly, 66% of people said my treatment and my care was their biggest concern, but a significant proportion also talked about emotional well-being. And I hope that we were able to address some of the concerns. But before we close up and I hand things back to Jean, I just want to ask one closing question of each of you. If you could just tell us one thing that you are going to do for yourself today after this program is over to kind of keep yourself centered. And I'm going to start with Nani this time.
Well, today I think what I'm gonna do, I'm just going to enjoy my husband. We are going to watch some movies on Netflix or some things that that we heard was a good movie, good show. So I'm just going to enjoy my husband today and just watch movies and just relax.
Thank you, Nani. Janice?
Well, normally living in Florida, I would be out in my pool, but we are currently experiencing a thunderstorm. So for me, a good rainy day activity is to read a book. I find that reading mindless fiction it transports me out of the real world where our concerns are cancer and COVID as well. And I am completely immersed in another world where none of that exists.
I like that idea.
Mm-hmm.
And Greg, what about you? Because our healthcare professionals need to keep themselves set as well during this time.
So tonight we're having a 5 o'clock Zoom conversation with another couple with whom we're friendly, and really haven't seen them in a very long time. They live 1.5 miles from us. I go outside. I work some remotely, and I work some from downtown. But I go outside and I take a walk. It becomes a little overwhelming being inside all day. I have a step thing on my watch, and it tells me how many steps, and my steps have gone down dramatically. And it kind of reminds me to go and do so. Like I walk to the bathroom and the copy machine, and the bathroom and the copy machine, and I need to do a little bit more than that. So I think that helps too. And any streaming anything that is escapist is great. Thank God. I mean, if the internet goes down, we're going to be in a lot of trouble.
Well, let's hope that does not happen.
I'm not anticipating. I'm just,
Yeah, I know.
We're really dependent.
Well, I want to thank all of our panelists today for your time and for sharing your expertise. Thank you.